Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 35 of Lengthening Live, where the patients get to interview the guests. And today we're doing it again. We're doing our cosmetic limb lengthening roundtable full of awesome patients. And to get the show started, I want to introduce the guests. So to the right of me, we have a famous YouTuber who goes by the name of Height Journey. What's up, HJ? How are you doing today?
Hi, Victor.
All right. Down in the bottom, in fact, let me give him a better seat. There we go. He's
Thanks.
now at the top left. We have King Nicholas from Nicholas's Leg Lengthening Journey. I'm going to plug both of their YouTube channel links below this video at the end. I didn't get a chance before, but we have Nick as well. And then in the bottom right, we have a return patient from way back last year, Leon. What's up, Leon?
Hello, how's everyone?
Doing great, man. Glad to have you a part of the stream. All right, guys. So yeah, we're gonna get right into it. So I had a few questions that were submitted for you guys, and then we're gonna go ahead and answer questions from the chat. It's gonna be really kind of casual today. So let's get right into it. So first of all, what I want to do first is do a follow-up with everybody, because this is kind of like a follow-up, patient follow-up. Everybody, one of these guys had surgery. So let's start with you, Nick. Tell everybody, remind everybody what your lengthening surgery goals were, what you achieved, and where you are right now.
Okay. Well, my goal roughly initially was about 5 inches, but there was some flexibility with that. I was going to achieve that by doing 2 surgeries back-to-back, tibias and then femurs. I gained, 5.5 centimeters on the tibias, and then I gained 6 centimeters on the femurs. And then when you convert that into inches, that's 4.5. I could have done more, but I was happy with my proportions. I figured that, my reasoning was once I'm like 6 foot, then it's just up to proportion, just how I look. And so I was happy at that point. As far as where I am in my recovery, I have full range of motion. My stamina is really good. I walk at least a few miles every day. I can run, albeit with some pain in my tibias from the screws. What else? I can jump. I don't really have any limitations as far as like things that I would just typically do on a day-to-day basis, but it's coming along nicely.
Yeah, man. I just saw actually 2 of your recent videos of you doing some physical movements. Like I saw you doing hiking and jumping and running. It's amazing what you can do so soon after the surgery recovery. I know your surgery was a while back, but in terms of what you did quadrilaterally, it's impressive. So
yeah, no, it was pretty extensive. I feel good, and I wake up, I don't have any stiffness. You know, I remember before that I would wake up and I'd be like, oh man, I'm kind of stiff, you know, but now I wake up and I'm like I don't know, like, I mean, I woke up a little while ago, but like I can bend just fine. And
that's crazy, man. And tell everybody, like you're on your feet a tremendous amount of the part of the day. I mean, you said like you're working 14-hour days, you're on your feet all day, lots of steps. Do you think that helps, or do you think it hurts?
Sorry, what was that last part? Do
you feel like being on your feet a lot and actually getting a lot of motion actually helps, or do you feel like it makes it like more stiff?
Oh no, I think it helps. I think it helps. And my coworkers, they would comment often saying, "Wow, Nick, you're moving a lot," because I'm very active. You know, I tend to not be sedentary if given the choice. Like even when I'm on the phone, like I have to stand up and pace. So you know, I work as a nurse, and I'll stand up in the unit and just like pace when I'm on the phone with the doctor.
That's awesome, man.
Yeah,
that is incredible, man. Well, we were so happy that you're doing well, especially after a quadrilateral lengthening. We're gonna be following you, you know, exclusively because you're a real big, you know, I mean, a patient that does, you know, both segments is one that everyone wants to know about. So, all right, so moving right along, we got HJ, Height Journey. What's up, man? How you been?
Hi, Victor. So, a summary of myself.
Yeah. Give everybody a summary of your surgery, what you achieved, you know, where you are right now.
Yes, in March of 2021, 14 months ago, I had a femur lengthening surgery with a precise 2 nails with a Dr. Asiag in Baltimore, Maryland. And I gained 7 centimeters, which is 2.75 inches. So that makes me about 5'9.5" now. And it was well worth it. That was about my goal anyway. I didn't really want to go all 8 centimeters because it was I thought it would maybe look a little weird for my femurs to over lengthen, and it was just also long enough. I think it was good enough. And So it's been 14 months now. I thought I was going to probably get the rods out around this time frame, but it just needs a little. One of my femurs just needs my left one needs a little more, just a little more consolidation. So maybe in about 3 more months, it will be eligible for rod removal.
Okay.
And I'm pretty much recovered now, so I can run pretty slowly, and I can just walk for many miles, and so I pretty much recovered all my physical abilities. That was kind of troublesome. And just one more thing. Yes, I am looking to getting tibial lengthening this summer. It's part of my because I also have a tibial torsion on my right tibia where my right foot points outwards. In other words, so
yeah.
So some of it will be covered under insurance, and I'm going to take that unique opportunity to get tibial lengthening as well. I'm like about 96% there. It's not fully committed yet, but it's about 96% there. I'll know pretty soon. It's going to be sometime in the summer. So all you have to do is subscribe to my blog, my YouTube channel, and I'll announce it when I'm 100% there.
That is impressive.
For this interview, I'm going to probably focus on femur lengthening, because that's where I'm the expert on, because I've been through it. I haven't gone through the tibial lengthening yet, so I can't really comment too much on that yet, but I will in the future.
Yeah, that makes sense. Yeah, and I like I said, I'll post both you guys' YouTube channels below once we're all done. But if you didn't hear what HJ was saying, is that he's going for quadrilateral lengthening as well. It's just he's going to find a nice little loophole in there to get it corrected and covered by insurance. I love that.
Partly covered by insurance. Yeah.
Partially covered, but hey, it's a big help.
But it's always a big help. Yes.
Absolutely. All right, and now we have the return guest. Leon, what is up, my man? How you been?
Yeah, everything's been going well for me, So basically, it's been officially 1 year, just over 1 year with my surgery, and till now I feel very, much more physically better, mentally better, since I had my surgery. Because I remember speaking to the first interview how like things were a bit hard for me, I wasn't really at the best state of my recovery. But apart from that, I feel much more better. I'm getting my fitness back. I've been going to the gym, working on my body. Like I've been working with my physiotherapy as well. So I'm basically, I can fully jump, run, but not like before, slowly getting there. But I'm just happy with my progression, really, with my surgery, and I feel like I've recovered much more quickly.
Yeah, no, I think you recovered amazingly well based on the video that you sent me, and I'm going to share that in a second. It's a video of him actually sprinting in the streets, really cool. I had to blur the face out a few minutes ago, but anyway, Leon, last time we talked, you were having, like you said, a few hiccups along the way. You had a little bit of a struggle. How did that? What happened? What was the turnaround? What was the turning point? Was it your physio? Your focus on the physio, or did your body just like kind of? Did you get more medical intervention? What happened? We haven't really caught up with you.
So basically, at the time when I spoke to you, I just had doubts. I felt like, like when you go through pain and you struggle, like you just feel like it's the end of the world. Like you just feel like you're not gonna get better. You just start thinking about complications of, of your legs. Like, am I really gonna get better in the long term? So I just had to be patient. I was just listening to my physiotherapy. Like she was just guiding me exactly what to do, like stretches, and mainly she told me I had to do more of like leg workouts, working on my legs, because when I had my surgery, I forgot to say, I had an external fixator, lengthening over now.
Yeah.
So at the time, I lost a lot of muscles in my legs. They were quite like muscle atrophy. So my muscles were very thin, and so I just had weak legs. So I just had to be strong and patient, and I just kept on going, and I just took my recovery serious, really.
Yeah.
And I just see the progression from there, really. So, yeah.
I love that. And I'm hearing the same thing from all of these guys right here. Nick, HJ, and Leon. They took their physiotherapy, their rehab, their recovery, the rebuilding process super seriously, and look at them all. Pain-free, back to it, getting, better and closing in the gap to getting back to where they were preoperatively. It's impressive. So that's why I'm really saying that if you do things correctly, you lengthen wisely, and you rehab properly, you can get back. So it's really impressive what you can do. So Leon, do you mind if I share that video of you running real quick?
Of course, of course.
Okay, so guys, this is actually a video of Leon running. Let me just see if I can pull it up here. Actually, while I'm doing that, I'm going to ask the other submitted question that was brought in by a patient, and any one of you guys can take it. It's basically saying, why doesn't the X-ray amount of length that a person got in their X-ray match up with the height that they're measuring their height at? So Nick, do you want to take a stab at that? So
yeah, no, I will do my best. I can think of a few different reasons for this. One is that, I don't know what that sound is. One is that the femur actually isn't perfectly perpendicular to the floor. So that means that it wouldn't translate 100% to height, but I think that that angle is pretty small. So most of it would, but that same kind of logic would apply to the X-ray film. You can imagine, like, if you have, let me see, like if you have, like, this is the plane that you're taking the image in, and you have something like this, like say a long bone, and then you angle it like this, but you're measuring, if you rotate 90 degrees, you're measuring like this. Does that make sense? So you're not getting the full length. So it's artificially shortened. So that's one possibility. The other thing I think is changes in posture, because I noticed the same thing with me. My dad, he was like, he's like 5.5 and 11, something like that. So he's almost 6 foot, just a little under 6 foot. And I was like, okay, I'm 6'1". And I'm like, wait, I'm just like a little bit taller than you. Something is wrong. And then over the ensuing months, then it became much more pronounced, the height difference. To where now, like, I see it next to him and it's like, okay, I'm considerably taller than him. So I think there are postural changes over time. The other possibility is, like, if you're doing like lawn method or something, if you have basically a ruler that runs parallel, or should be in theory parallel to the bone, if you have any deviation, like say maybe early consolidation of the bone, anything like that, then it wouldn't be accurate. But I guess that's not quite what was being asked, because that would still not explain the X-ray, but kind of the same logic behind it. So that's me just speculating.
Yeah, I think you were right on the money right there. And I think the postural changes is big. And like you said, the femur, the anatomical axis versus the mechanical axis is big. And where it's measured from. And HJ, do you want to pitch in on that?
Yes. I have some theories as well, including in addition to what Nick just said. I think another reason is because, like, when you're after lengthening, especially the femurs, it's very hard to stand up straight. So a lot of people, when they're done lengthening, they try to measure themselves, but they're not able to stand up straight. That's why, because when I was like, especially with the femurs, like you have tight hip flexors, so you have duck ass, and then you can't also, it's also hard to stand up straight at your knees because you can't straighten your knees out very easily, and it can take months. And some people measure it right. I'm like, when I was on lengthening, I was like half an inch shorter than what I was supposed to be.
Okay.
It took me about a month to fully extend. I think some people can take even months, like 6 months or maybe even more, to fully stretch out like their hip flexors and their quads and hamstrings and at the knees to fully stand up straight.
Yeah, I 100% agree with that as well. Muscle tightness, he's saying residual muscle tightness can actually prevent you from getting, or, noticing your true length. And until that resolves itself, you probably won't see your same amount of length that you got from the X-ray. So yeah, great tips there. Oh, okay, we have Optimus. He just joined, so he was a little late to the party, but we got him in here now. What's up, Optimus? How are you?
Good. Sorry about that. Is my voice modded? Can you guys hear me okay?
Your voice is modded as well as it always is.
All right, great. Sorry about being late, guys. It's some technical difficulties.
You are fine, my man. How you been?
I've been good. I've relearning how to walk was harder than I thought it was going to be, but other than that, yeah, I've been good.
Yeah. So for everybody that's watching, Optimus was on maybe about a month, couple weeks, maybe 6 weeks ago, and he had finished he was just about to finish his length, and he's done now. He's achieved full 8 centimeters, correct, Optimus?
Yeah, I went to full length.
Full length, internal nail in his femurs, and he's going to actually explain where he is right now, because it's really interesting. He actually opted into Dr. Debbie Pershad's accelerated weight bearing program. You want to talk about that, Optimus?
Yeah, sure. So I was probably like the fourth or the fifth patient to undergo the nail swap surgery. So in summary, what it is once distraction is over with the precise 2.2, Dr. Devi Parshad waits about 7 to 10 days to allow some consolidation to happen and for the soft tissue to get a little bit of a break. And then he basically goes in and removes the both precise nails, and he replaces them with a full weight bearing trauma nail. So non-telescopic, the same kind of nail that you would use if you were in if you're someone who's in an accident who had a femoral fracture where they're trying to essentially salvage the bone. And so I'm about a little bit over 2 weeks after the nail swap surgery, and yeah, so I'm currently on my quest to relearn how to walk. It's not just like as easy as you put the trauma nails in, you start walking. It's actually much more complicated than that. But yeah, I don't want to take the ropes here, Vic. Whatever questions. I know this is a roundtable, so if you want me to talk more about that, I definitely will. I just don't want to take the floor too much here.
No, man. Actually, what we were doing before you came on was actually doing a catch up with everybody, and we wanted to kind of catch up with you. So you put you swap the nails. You have the trauma nail, and now you're allowed to weight bear. Was it painful when you took your first few steps?
Oh yeah. So I just want to emphasize something. Getting a nail swap surgery is it's non-trivial in that you essentially are going to have the same post-operative period that you have from the first surgery. So in other words, like, I think people expect like, oh yeah, I'm just taking the nails out and putting new nails in, but they don't realize that what's actually involved in the procedure. They actually have to remove screws, remove the nail, reinsert a nail, re-ream the canal, and then also insert new screws proximally and distally. For me, I'm a heavier guy, so I actually had 3 distal screws placed. Most often it's usually 2. So that said, I was as stiff as a board and super swollen after that surgery. It's not just like a walk in the park. It was definitely like painful, almost as painful as the first surgery, actually, believe it or not. So I just want to, I want to put out there in the interwebs that, for people who are considering it, it was still worth doing. Don't get me wrong, because I'm fully weight bearing now, but you still have to tolerate like a rough 2 weeks of, pain, stiffness, swelling, all that stuff. So
yeah, that makes sense. It's another surgery, like you said, and it hurts. I mean, you're going back in through soft tissue and bone reaming and all that stuff. So very good advice for everybody out there considering that. But let me actually right now, I want to actually go back to what we were about to do right as you came on, is show Leon. He sent in a video, and Leon is another patient that we had on a while back, Optimus. I don't know if you've heard of him, but he sent in a video of him running. So this is Leon's video. Let me just pull it up here. Here it is right here. So I don't know if this is showing, but here he is in the street. Looking good. Awesome. There we go. Let me just stop sharing. Oh, shit. How do you stop sharing? Okay. Well, anyway, once I figure out how to take that off the screen, we will be back on. But anyway, Leon, can you remind everybody how much length you actually got in your femurs?
So basically, I was my height was 182 centimeters, and I lengthened the full 8 centimeters, so that made me 190 centimeters.
Wow! So you did the full 8 centimeters, and you're running like this. How long was this video taken after your once you were able to start to weight bear, like walk without the frames?
So this was like, I would say, this video that was taken around like 10 months, so 2 months ago.
Oh, 2 months ago. Okay. So you're just, like you said, at the 1 year mark. It was taken at 10 months. You were able to sprint in the street like that.
Yeah.
After 8 centimeters.
Yeah.
Incredible.
Yeah.
Absolutely incredible, dude. Like, you must have been working really hard. You said I motivated
you. Of course.
you. You're motivating me.
Of course. Literally, like, when I think of it, like, it makes me feel like I really did come a long way.
Yeah.
Of the surgery. So yeah, I just had to just, like what I was saying to you before, I just had to keep strong and just motivate myself because, you know, because at first my legs were quite weak, like I was saying to you. Yeah, so that's the reason why I couldn't fully sprint or run properly. So I just had to work on my leg muscles and, you know, make sure it becomes more strong and, yeah.
Absolutely.
And
Now,
flexible as well.
Do you feel like where do you feel like you are in terms of full recovery? Do you feel like you're 80%, 75%? Where do you think you are?
So out of 100%, I would probably say 80, 85%.
80, 85%. That's incredible, man.
Yeah.
Wow. And are you also working out with the weights right now? What is your exercise like?
I'm just working on the weights, full body, but mainly I'm doing more of my legs. I'll probably say that 3 times a week.
Okay.
So yeah.
Gotcha. Awesome, man. Awesome. Let me see how I can exit this out now. Not sure how. I'll figure that out in a second. But anyway, let's go to the next question. All right. So the next question is limb lengthening weight bearing devices, the state of affairs. So, all right. So this is taking us down the recall of the Stryde now. Everybody knows about this. This is actually why Optimus opted into that accelerated weight bearing program that Dr. D has going on. So who wants to take a stab at this? Height Journey, Stryde nail, recall, not having a weight bearing nail in the market. What do you think about this?
Look, what's the question?
Well, the question was just like kind of getting your thoughts on, you know, not having a weight bearing nail or possibly going for something like what Nick did with his tibias. I think, Nick, did you do lengthening over nail on both femur and tibia, or was it just the?
Yes.
You did.
Yes.
Okay, gotcha.
I do not recommend doing it on femurs though. Like unless you absolutely have to. It's pretty rough.
Is it?
It's
yeah.
awful. It is. It's bad.
Oh my gosh, I don't know why these people didn't tell me how to X off this video. But anyway, yeah. So talk about that. Let's talk about the weight bearing nail sabbatical that it's taking right now. Anybody want to take a stab at that? That's what somebody wanted us to ask today. So.
Yes, like when I think it's gonna return, or when we have a replacement for Stryde, or
yeah. Let's talk about do you think Stryde's gonna come back and what form? I mean, that's what everybody's asking. That's the biggest, debatable question right now.
Well, they say the latest prediction is 2023, but that's only a prediction. Nobody can really predict the future, so
yeah,
we really don't know unless you have a replacement. But I haven't heard any news about any other replacements either. There's some mentions, but nothing conclusive.
Yeah, I mean, I actually don't want to get in trouble here for saying too much about the weight bearing nail, so I think maybe we'll skip that question for now, unless Optimus wants to say something or Leon. I don't know, but anyway, let's actually just answer some questions from the chat. Everybody's asking questions in the chat, so let's see here. Tim Boy, Nick did what I want to do. Basically, he did quadrilateral lengthening. He got Nick. You said it was about five inches.
Yeah, a little bit less.
A little bit less than 5 inches. Gotcha. Oh, here we go. I see how to take this off the stream. Here we go. Hold on. Boom. We're back. Okay. A little bit less. Okay, good. Nick, another question for you. Do you have knee pain, Nick?
No, I don't have any knee pain.
Wow, that's crazy because they went through that patellar tendon. That's interesting. Okay. HJ, this one's for you. Are you planning to do tibias as well as your femurs once you're fully consolidated? Just in case people didn't hear when you first came in. You want to mention that again?
Yes, I made a brief announcement at the beginning of this video, but I know we always have people coming in later, including what I've done before. So, yes, I'm planning. This summer I'm planning to do tibial lengthening because I also do have a medical condition called external tibial torsion on my right tibia, where my right foot points outward. So I'm going to include that as well. Have it partially covered by health insurance, and I'm like 96% there. When I'm 100% sure, including the date, I'll announce it on my YouTube channel. So just subscribe to my YouTube channel, and you'll see any announcements on that and updates on that.
That's right. We're gonna have his link and Nick's link below the videos after this. Another question going to Nick. This Kim boy loves you, Nick. He's asking, what physical activities did you do pre-limb lengthening? Did you take any prep, Nick? Did you take any?
My preparatory work for limb lengthening really was just stretching, and I did my tibias first, so I focused on the Achilles tendon. So just several variations of, they're all basically the same thing, but I did that a few times throughout the day. So I did that at least 1 month prior. I think, it was about 1 month prior when I started.
Okay, gotcha. Next question here from Benjamin Mendoza. He's asking, is between the ages of 21 and 23 a good age to get limb lengthening done? Because I'll be 20 soon. Now, Leon, I know you're a younger guy. You want to hop in on this one?
Yes, I can definitely answer that question. Yeah, so when I got the surgery, I just turned 24. So honestly, I feel like the younger you do the surgery, the better it is, to be honest. So yeah. I would definitely say it is quite of a good age to do them living at that age, to be honest.
Yeah, I remember my surgeon, Dr. Conway, said the same thing to me. She's like, you can wait 5 years, 10 years, but if you get it done right now, it's always, the best time is sooner, if possible, if, things line up, obviously. Thorfinn, what's up, man? We've been missing you. Is Kyle joining the live? He was actually on, but he had to do something, so unfortunately, he's not going to be a part of this live. We'll hopefully have him on in another live. Let's see here. Let's see. So actually, I don't have Randy in the back, so I'm just sifting through these questions myself. So I'm just looking there. Okay. What age of height journey can you answer? Oh, they're asking for your age, height journey. I don't know. You can answer it if you don't want to. You don't have to.
Okay, I'll just say I'm over 35. That's all.
Gotcha.
If I've had several people ask me about that question, because the main concern is like they're like over 40 or 50, and they're wondering if an older patient can do it. I do have a video on that. So in my YouTube channel on age limits, and just for the older patients, yes, it's possible, even age 40 or 50. It's just as you get older, you might not get as much length, and you may take longer to lengthen. You may not get as much length as somebody in their 20s, but it can still be done and very successfully.
Gotcha.
But that's a brief summary.
Yeah, that's true. I mean, we had Nico on last week. I think it was 2 weeks ago, and she was 52. She did quadrilateral lengthening. It's pretty crazy stuff out there. Next question. Let's see. HJ going for the quadrilateral. That's right, Thorfinn. Okay, so this one is for, I'm not even sure who that's for. How did you experience the difference between the surgery for the femur and the tibia? So, Nick, you were like one of our only quadrilateral patients on here, so you want to kind of hop that one.
Okay. Yeah. Okay. Well, the femur was much more difficult than the tibia. I think that's really just because it was long, and it's just because of the difference in the soft tissue thickness. I mean, you're going through the quads and just some really large muscle groups compared to the penetration with the lower leg. It's much more superficial, and there's no real restriction as far as flexibility with tibias. Whereas with the femurs, initially, like post-operatively, you can't bend that much at all. And then you work on your flexion throughout the lengthening phase, and then it becomes easier to regain flexibility after removal. But the other thing is that it's much easier to isolate the pain with the tibias compared to the femurs, because the tibias are more distal. The femurs is like you go to the bathroom, you're sitting on your injury basically, whereas with the tibias, you can they're away from you, so it's not as much of an issue. Having said that, I do have a friend who did the same thing as me. We did it at the same time. We did the tibias first, both with lawn, and then I did lawn on the femurs, and then he did precise on the femurs. And my experience was much more painful compared to the tibias, and his was less painful, substantially less painful. So there's some insight for you. Another reason to do precise and not lawn on the femurs.
There you guys have it. So internal nails instead of the external fixer on the femurs, he said. So
on the femurs, it's absolutely viable on the tibias, but it's awful on the femurs. Happy I did it, but
Yeah, and like Leon, would you concur with that? Would you agree with that?
For sure. Because obviously I had the LON femurs, and it was just a painful experience and time for me, because at the time when I had to go back to remove the fixators, the external device, like I started the pin started to get infected, and I just couldn't sleep for a couple of days because it was stinging. Like it wasn't like, I wouldn't say, I wouldn't really say to someone like if they were considering of getting lengthening done, I wouldn't really tell them to go for the lengthening over now, because it is quite painful, and you know, it can easily get infected, and yeah.
Yeah, no, definitely. That's good. I'm glad you guys are bringing that up and giving everybody out there future prospective patients. Optimus, you had internals on the femurs. Are you still there, Optimus? I don't know if, let me see.
Yeah, I'm here. Sorry, Vic. Yeah.
There you go. What now? I know you said this in your initial, live stream interview that we had a few weeks, a month or so ago. But what was your pain like after you had the nail swab? Was it manageable? Did it drop off a lot quicker than the first surgery? Talk about your pain with the internal nail. On the internal trauma, the swap, the nail swap.
Oh, for the swap, yeah. So, I have just for everyone's background, I'm not an orthopedic surgeon, but I do speak from a medical perspective. I'm a fourth-year med student. I'm graduating pretty soon from medical school. I'm going into the surgical field, so I do have some, I guess, like above average understanding of the human body. Mm-hmm. And I'm only saying that because, like, if I start to use jargon that's like, kind of medically complex, I apologize. But in regard to the pain, so I think when it comes to the pain from the surgery, there's really three sources of pain. The first is the osteotomy. So the first surgery, there's the osteotomy site pain. In layman's terms, it's because you broke your bone, like the surgeon literally broke your bone. So of course that's going to be painful. It helps to kind of visualize, the surgeon doing all of this to you while you're awake to kind of predict what the post-operative pain would be like. So imagine if I took a chisel to your proximal femur and just like hit it really hard while you're awake. That's literally what the post-operative pain is like for the osteotomy site. The second source of pain is the screw site pain. So where the screws go into the femur. So in total for the precise nail, you're going to have 4 screws, 2 proximal screws. By proximal, I mean close to the midline, so close to the hip, and actually a few centimeters away from the hip joint. And then also distal screws, so closer to the knee. And so those 4 screws, so imagine if you were awake and I took a screwdriver and then I like had you lay on your back and I said, okay, close your eyes, I'm going to screw into your femur. That's the second source of the pain. The third source of the pain, and this is probably the least talked about, is the reaming of the intermedullary canal. So the bone marrow is just like bone, is living tissue. So when a orthopedic surgeon reams the canal, they do this all the time for for non-limb lengthening reasons, for like insertion of trauma nails or whatever else. But the intermedullary canal, I suspect, and I haven't read a paper on this, but I suspect that reaming the canal also is a source of pain. 2 reasons for that, because I think the bone marrow as like this vascular, really viscous tissue, there are some nerve endings there. And then the second thing is the diameter of the intermedullary canal. Sometimes when they ream the canal, they're actually catching bone along with it. So, imagine if I took a long screwdriver with a spinning end and I stuck it into your femur and spun all the way through. So that's the third source of pain. So if you visualize those 3 processes happening simultaneously, that's 3 different, like, essentially really potent sources of pain. And so for the trauma nail, to answer the question, because they have to re-ream the canal distal and proximal to the osteotomy site where the callus is, that's inducing pain again. And then also removing and reinserting screws is another source of pain. So for me, the pain was the same as the first surgery when it came to the screw sites and the reaming of the canal. But the nice thing about the swap is you kind of lose that osteotomy site pain, which is probably the worst of the 3. So that's why I say it's not as bad as the first surgery, but it's still very, very painful because, again, I don't know anyone out there that can just sit still while they're getting their femur screwed into. So that's, I hope that answers the question. Did I answer that okay? I don't know.
You answered it perfectly, and I love the visuals, man. That was great. I couldn't help myself but laugh. It was great. Oh man, I felt like I was talking to Michael Myers over here. Great stuff. Yeah. So the The pain is not as bad, he said, basically because you're avoiding a new bone break, but there's still going to be soft tissue pain, screw insertions, and all that stuff. So I think we just lost somebody. I'm not sure who that was. Is that Nick? Oh, maybe is he purposely going off? Or
Can you hear me?
Yeah, I can hear you, Nick. There you
Okay,
go.
cool.
For some reason, I think it dropped off, but that's cool.
My computer was dying, and so it's the same cord, so I had to disconnect this, and I'm using the internal mic.
Oh, you're good, man. No problem. Cool. Next question here is, let's do this for Leon, since he's from the UK. So Arthur's asking how to get free physiotherapy in the NHS, and how many sessions of physiotherapy did you do during your lengthening?
So how it worked, because I was unemployed at the time when I was going through the surgery, I was entitled for physiotherapy, and with the sessions, they didn't really give me how many sessions I need. They just looked at my progression and see if I was fully 100%, back to normal. That's when they would like discharge me and release me. It was like, saying, yep, you're good to go. I don't think you need any more physiotherapy, but just stick to your workouts and stretches now and then. But yeah, really, they didn't really give me any specific of numbers of sessions that I need to do. So yeah.
Gotcha. But so they worked with you to kind of like solve your problems, but they didn't say that you needed any specific amount. Okay.
Yes.
All right. There's a question in here for Optimus, and then we're going to have one for Leon, and then HJ, I think there's one in here for you. Optimus, is back to you. Optimus, does physical therapy make a big difference with your recovery? Does 5 days a week make a difference, or can you do 3 days a week?
Good question to Maddie. So I maintain 5 days a week throughout all of distraction. There are probably some weeks where I did 4, just because I couldn't make it to PT or there's a cancellation or something. But I maintained 5 days a week throughout, and so I don't really have the perspective of doing 2 or 3 days a week. I know Dr. Asiag likes to do 2 or 3, I believe. HJ knows more about that, but it's hard to say, Maddie. But I think 5. I liked 5 for 2 reasons. One, it was kind of like a nice thing to have in my schedule for the routine aspect of recovery and distraction. I think having a non-weight bearing nail as a bigger guy, I weighed 230 something at the start of the surgery, and I gained some weight actually starting consolidation, which I know a lot of people lose weight, but for me it was the opposite. Having non-weight bearing nails, it made it so I really wanted something to get me out of the house and just give me a reason to be mobile and leave the house. So I think having that in my schedule really helped mentally from a psychological perspective. From a physical perspective, I don't think that. I think more is better in the case of physical therapy. Obviously, the same is not true, and then Vic, a lot more about this. There is something called overtraining. But I think overtraining is something that occurs more in heavy resistance exercise. So if you hit a max bench one day and you do the same thing the next day and you're not eating very much, that's a recipe for disaster. But in the case of physical therapy for limb lengthening, we're not really doing heavy resistance work. And so long as your nutrition is adequate, I think that it's nearly impossible to overtrain. If anything, you should just become more flexible. So. To answer your question, I think 5 days for me was superior, both physically and psychologically. However, I think that a disciplined patient can get away with 2 or 3 formal physical therapy sessions a week, so long as they maintain a regular schedule at home, with the same equipment that a PT would use. So.
Love that.
Yeah.
Love that answer. And that's exactly what I agree with, because I think I did 5 for a little while, and I trimmed it back to 3 because I was catching on so quickly and I knew what to do. So yeah, exactly. HJ, how many did you do for your lengthening?
Yeah, I started off doing 3 sessions a week at the PT center. Okay. But then later on, as I was lengthening more, I got up to like 4, then to 5 sessions a week.
Gotcha. So you trimmed it. And Nick, how many did you do?
So I was a minimalist As far as finances, financially, I was a minimalist.
Oh, gotcha.
Really by necessity. It wasn't so much a choice. I always recommend doing as much physiotherapy as possible. But there was the financial limitation with me because I barely had enough funds, so I had to stretch it thin. So I did 1 session a week with a physiotherapist, and I basically just tried to emulate what I saw them do, and so I did it rigorously myself. So like with the tibias, I would do 5 hours a day. But it was only once a week with a physiotherapist.
Gotcha. Okay, gotcha. All right. We have another question here for Leon. Leon, let me see. Let me unmute you. Leon, this question is from Janu. He's asking, did you return to Bordeaux for your fixator removal, and did your experience improve for the better with the team there? So, did your experience improve with the team there?
So basically, it was quite. When I was in contact with my the surgeon who done my surgery, the doctor, he basically sent me a video of him telling me how to remove it of the fixator. So I was quite like shocked, thinking, but I was thinking, you know what? I was just a bit nervous and scared. I was thinking, let me just go back to the country and see him and let him do it instead. So. Gotcha. Yeah, I just didn't want to risk me removing the fixator myself. So I just find it a bit like, I just didn't feel that would be the right way of me doing it myself. So I went back. It was like, but while I was in the plane, I just had a painful time because if anyone know how a lengthening of a nail works, you sitting down with it or lying down in a bed, it gets painful, especially like. The pins were really like stinging my skin. So when I got there to Turkey, they took me to the hospital the day after. So I stayed at the hotel, and I was at the hospital for 3 days before. So when I got to the hospital, they didn't really remove the surgery. They didn't remove the fixator straight away. For some reason, there was some COVID problems with saying that they couldn't. So I had to stay in the hospital for 3 days. Then they done me the surgery, and it was just it was a weird experience because like they didn't put me to sleep. They didn't do the general anesthesia on me. Yeah. So I was awake while they were taking off the fixators off my leg.
Yeah.
So they managed to. I can even feel them cutting my skin. I think they were putting in locking screws inside my thighs.
Okay.
So all I could see, I'm just lying down and I could just see the mirror on top of them. They're just they're doing the surgery on my legs. I'm thinking, wow, like they just said to me, we're just gonna numb your legs. So I think they managed to inject something in my spine, like anesthesia. So my whole leg, my lower body was all numb. So after that, I went to the hospital. I got back to the hotel the day after, and from then it was my legs were so sore, stiff. Like if anyone knows, when you fully get the device off your legs, it's just that's when it really starts with you getting better and back to normal. So it was just, at the time when I was in Turkey, I just thought, because I was still in the walker. My physiotherapy would come sometimes to the hotel and make me do some legs exercises on some resistant bands. So really.
That's an ordeal right there just to get the removal. But no, that's true. I think they give you some local anesthetic. Optimus, do you know if they did? Is that a nerve block that they did for his?
It sounds like he either got an epidural, which is when they insert when anesthesia is given into the spine, the lumbar spine. What that does is it basically numbs patients from the waist down. The other way to do this is you could do what's called a femoral nerve block, which is where you actually insert anesthetic into the femoral nerve. So in that case, you would just numb the leg from about the greater trochanter of the femur and lower. Basically, you just numb the femur, tibia, and the foot. So it sounds like he had an epidural, which those tend to last for about 24 hours, and oftentimes patients will. On that 23rd hour and 59 minutes, as soon as the clock hits 24, you go from no pain no sensation to just like sudden excruciating pain.
Yeah.
And so, for those who've never had epidural, it's quite a trippy experience. It's not necessarily, it's not necessarily the best thing for the lengthening. I don't think it's necessary. It can also make things more challenging because you're not really able to move your leg.
Right.
So you lose the ability to move your leg also, but it can also be good because you don't wake up with that excruciating post-operative pain. So there's pros and cons
to it. Yeah. Well, thanks for that explanation. Yeah, for all our viewers. Well, we're glad that you're doing okay, Leon. But you're right. Now, Leon, I have one question to follow up with that, because there was a patient who had lengthening over the nail femurs recently, and he said that after he had the frame removed, he had trouble bending his knee. Did you also notice that, like, let's say in the first week after the removal, and did it get any better, and how soon?
So basically, definitely, I can 100% say that I definitely felt like my legs were lighter,
Okay.
because I feel like the frames that were attached to my legs, I feel like they were quite heavy, like.
Yeah.
So once they removed, I wouldn't say I couldn't fully bend my legs, but I feel like as time went past, like, because I stayed there for like 2 weeks, I didn't just got the fixator removed and went back to UK. So I stayed there for 2 weeks. So the physiotherapy was seeing me nearly every day. So I would just say just couple days or 2 days, 3 days before I went back to went to UK, because the UK basically said that Turkey is a red list country, so I had to wait. Yeah, I couldn't really just go straight away back to UK. So yeah, my legs at first, my legs were just so stiff, like I couldn't bend. Like I was basically walking crippled.
Okay.
So
Okay.
yeah, so
That's helpful.
I
Yeah.
just So from then, stretching was just helping bit by bit.
Bit by bit. When do you think that you were able to get full bending back? Because this guy's really worried about that. The guy that I'm talking about, he's not on the stream.
The full bending, I feel like it varies with everyone, to be honest.
Okay.
Like as long as because at first when they removed the device, my legs were tight, they were sore. So I feel like with constant stretching, your legs will get better time to time. You will eventually get flexible, and you will eventually get your range of motion with your legs.
Yeah.
So yeah, it could be a couple weeks or a few months. It just depends. You just feel little results time by time with your legs. That's what.
Yeah, Nick, can you elaborate on that a little bit? Like, when do you think that, like, what was it like when you first had your femur frames removed?
Oh, so when I had them removed, the rate of recovery, it changed over time, but it was like linear for the first, like the first 100. Let me see. I'm trying to remember that. I think like post I was about like 80 or 90 degrees, and then I regained my flexibility, my knee flexion at a rate of about 1 degree per day until I was at like 135 degrees, and then it slowed down. So like asymptotically approaches 180. You definitely have diminishing returns as you get like past 135, 140.
Yeah.
But that's how it was for me. But I've noticed a lot of variability when it comes to the rate at which you regain your flexibility when it comes to lawn on the femurs. I don't know why. I think it's basically a non-issue with any internal method, but for some reason with the frames on, there's just a lot of variance, patient to patient. And you'd be inclined to like say, oh, well, let's do the difference in work ethic or something. But I know some patients who worked really hard and they still had issues. So, I'm not quite sure.
Gotcha. And I also think that it has to do with the order of lengthening. Like, you did your tibias first, correct? And then femurs?
Yes.
Yeah. So if you're doing quadrilateral lengthening, especially if you're doing it with a short time frame, let's say a couple weeks to a month apart, definitely do the tibias first. Dr. Robbins said this in his interview with Lengthening Live. And it's because of that knee flexion. If you can't bend your knees, you need to do that for the insertion of that nail into the tibial canal, okay? Because you cannot do that. That's what this guy's having trouble with, and he's frustrated because now he has to wait longer to get that knee flexion back. So, next question is for HJ. Here, oh, she clicked on the wrong one. Sorry, HJ. Hold on. It's jumping. There's literally like 300 chat questions, but we're not gonna go through them all. We're gonna probably hold up for maybe 25 minutes more. Enrique's asking, HJ, how hard was the first 5 I assume 5 centimeters compared to the 6 to 7 centimeter mark.
Yeah, I can tell you it gets it gets harder every centimeter because it's basically like I've also been studying for the tibia since I've looking at it, but for the femurs it's like about like up to 5 centimeters. It goes up linear in goes up like linear in tightness or difficulty. Then from 5 to 6 centimeters every millimeter, it still goes up linear but steeper linear.
Mm-hmm.
And then every millimeter after 6 centimeters, it goes like exponentially more difficult. So it was, it was definitely noticeable. And I think, and for the tibias, I think it's like 5 centimeters for the femurs is about 3 centimeters for the tibias when it starts getting linearly harder, and then around like 4 centimeters, which is like 6 centimeters on the femurs, between like 3.5 to 4 centimeters. That's when it gets exponentially difficult every millimeter.
Yep, that's true. There's a certain threshold for every patient. You know, it really depends. But yeah, that's great. Great that you brought that up. And there's a follow-up question here from Parth. He's asking, HJ, how much length are you shooting for in your tibias when you go for that lengthening and that tibial torsion?
I'm not looking. I'm only about 3.5 centimeters to take me to 5'11".
Okay, gotcha. All right, this is a really good question, and I'm gonna go around the panel on this one. But he's addressing it to Nick, but we're gonna go around on everybody on this. And Parth's asking, Nick, you have had a pretty drastic height change. How do you explain your growth spurt to people who've known you from before? So Nick, let's start with you, and then we're gonna go around the whole panel for this. This is big.
That's a good question. I've had a lot. Got a hair in my mouth. Had a lot of people ask me that. So I actually didn't disguise it. I'm pretty open about it. And it's just because I thought, like, with one surgery, if I hadn't seen the person for a long time, then they might just be like, oh yeah, he's just taller than I remember or something. But if you have 2 surgeries, you know, that cumulative height difference is pretty big. And so there's really no way to disguise it, I think. And I'm not young enough where I can say, oh yeah, I just had a growth spurt, you know, unless people think that I'm younger. A lot of people do. But those who know me would know that that's not the case. So I just tell them, yeah, it's funny. A long time ago, I used to work at Walmart, and this is like many years ago. And one of my coworkers, she recognized me. She looked at me. She's like, "Hey," she has kind of an accent. She looked at me. She's like, "Hey, Nick," and she paused and tilted her head quizzically. She's like, "Hey, you taller." I thought that was funny. So you can't disguise it. I was pretty open. And the reception has been good, and I guess anybody who's going to be critical of that, that's kind of a separate issue. But it's the exception. It's not very common. And, yeah, I guess that's it.
That's awesome, man. I think that everybody who does quadrilateral lengthening, they definitely need to kind of be ready for that, because it is a drastic height change. I think 3 inches. Some people may notice, may not, and I think that other guys are going to be able to chime in on that. But when you do 5, 5.5, maybe 6, if you're lucky, you gotta just kind of be open with that. I think either that or late growth spurt if you get it early enough. So, Optimus, what was it like for you? How are you explaining it? I know your parents, you said they came to visit you while you were lengthening. Have you seen anybody else in your close inner circle, any coworkers or colleagues, anybody like that you had to explain it to?
Yeah, so I kind of put this into 3 different situations or reactions, really. Reaction number 1 is people who know you very well, like immediate family members, even some distant family members, who, you know, they know your height because they just seen you enough at family gatherings and such, or they live with you because they're your parents or your siblings. But in that category of people, I basically told the truth to them. I said that height is a really big thing for me. It's been on my mind since as long as I can remember. And, you know, this surgery means a lot to me. And then, so I told everyone in my family except for one of my parents. I won't say which one, just for anonymity. But the one parent that I didn't tell the truth to, I gave them version B of like my, you know, which is what I call situation B, which is the people that I don't want to tell the truth to, but that know that I got surgery. I just say that I had a limb length discrepancy. and I always make it more complicated than it actually is. Like if they ask, "Oh, how much shorter was your femur? Your left femur than your right?" I'll say, "Oh, it was 4.315 centimeters shorter." I make it sound really, so I use centimeters if they're used to the, American system. If they're used to metric, I'll use inches, so it just confuses them. And then so that's like, that was my strategy. Basically, just say like I had a limb length discrepancy. I fixed it. And it caused me to stand up straighter, and it, of course, made me stand on my legs equally. So I probably gained a little bit of height. So the reaction there was when they would notice, if those people were to notice that I was taller, I would say like, "Oh, really? Oh, yeah. My mom told me that too. Like, it must have been because of I fixed my discrepancy. Like, I'm glad you noticed." So that's worked so far. I don't have a large sample size on that study yet, but it's worked so far. It's believable. For the family members that know, they're just like happy for me, and they're like glowing as much as I am. I'm just like, they're just like super happy. They see how happy I am, and so it's just all good. For the third category of people, and this is probably where it gets a little bit more challenging, is the people who don't know the truth, but also notice that you're taller, and that like they keep asking questions about the limb length discrepancy to the point where you just like the lie just gets so distilled that you just have to change subjects. Yeah, that one's a little bit tougher to deal with. But so far, what I've noticed is that the people who don't know me very well, the majority are just saying that I lost weight. They're just like, "Oh, you look like you lost weight." I'm like, "Oh yeah, I lost a little bit of weight. I gained weight." And then I just don't talk about it anymore. But what I find fascinating, I think both HJ and Nick and Leon, actually all you guys can speak to this, is that even the people who don't know what happened, you can already sense like that they like are treating you differently. Like some people don't like this effect, but I actually kind of enjoy it, which is that you can sense the subconscious like better treatment from people. Mm-hmm. It's unfortunate that we're all biologically wired to like react to these things about physical appearance, but it's the reality for men. Height is like probably the number one or number two most like desired trait when it comes to physicality. And so, yeah, it's interesting to see that people are definitely treat me better even when they don't know what happened, so
yeah,
just thought that was interesting.
No, man, I'm glad you brought that up, because that's exactly what I want to kind of hone down on, because it's people's perception of people. It's like they're subconscious. They do treat people differently because of their height. So that's really good that you brought that up. And then Leon, tell us a little bit about how you explain it to people when they ask about your height change. I know you have friends, workout buddies, anything like that.
I don't know if you remember, Victor, with our previous interview, but I managed to say that I told you that I went through the surgery alone, so I had no support or just because I just didn't want to really tell anyone that I was gonna go through this type of surgery, because I just feel like people might criticize you or say, "Oh wow, you're crazy, man. How comes you're doing this?" or something. They'll say, you're not really that short. Why do you so it was just a thing where I just felt insecure at the time with my height, and yeah, but no one there. I've had friends saying to me, "Oh, you look taller now," this, and I'll just say, "Oh, maybe because I'm stretching, or maybe because I'm doing some yoga," so yeah, but a lot of friends have really noticed a bit of my height change.
That's
and
cool.
Yeah.
Awesome. So you can kind of like rub it. Yeah, I mean, I think that's one good excuse is like stretching, working out, like Optimus said, weight loss. That's another good one. Height journey. How about you? Any coworkers, friends, family members that you have to explain this to?
Yes, this is my story. So I was a little more fortunate because I went like 2.75 inches or 7 centimeters. So I think that's probably maybe I've gone the least of this group, I think, but I'm not sure. But it wasn't too hard because what I did was like it was during the coronavirus pandemic when we were all locked home, and I haven't seen a lot of people in a while. And the few people I did see occasionally, I just wore there's like these 2-inch elevator shoes,
Okay.
for like several months before my surgery. It was kind of hard to tell, and nobody really noticed, to be honest. And I told a few people when I was lengthening, just so they could help me out, and just a few less people to talk to. But it blended in pretty well. So most people didn't really notice because I just wear elevator shoes all the time, and just it pretty much hid a lot of it. And then like I didn't tell any of my family members before. So like when I met them for the first time after surgery, what I just basically did was I called them on the phone and I just told them that you're going to notice a major difference about me, you're going to notice I'm taller. And I just told them I want to. I mean, it's already done, so they can't do anything about it. So I'm happy with the results. So I just told them so I wouldn't have to, make up any stories or anything like that.
Okay, so you were honest with it. Yeah. You were open about it. That's cool. And I think that recently I was at the Paleo Institute with a patient there, and he guess what he did, guys? He actually he set out an email, scheduled an email to go out the day after his surgery. So to all his family members, all his friends, and said, "Hey, look, it's done. There's nothing you can do to stop me." I thought that was hilarious. So good old Rich. I think he has the best one of all. But anyway,
Vic, if you don't mind, I want to add something to Parth's question here.
Yeah, sure.
If that's okay.
Absolutely.
This is just advice to all those listening on, I think, the secret to basically eliminating the stigma of getting a cosmetic surgery. So I found that whenever you are getting a cosmetic surgery, and you don't want people to know, for example, if a female desires a nose job, but she doesn't want people to stigmatize her for the nose job. I found that the best way, and I could be wrong here, but I've noticed this across the board. If you explain the change as a necessity because of a medical condition, people automatically will no longer stigmatize you.
Yeah.
So, in the case of a rhinoplasty, if I say, "Oh, I had a deviated septum that was causing me to have, repeated episodes of sinusitis," suddenly they're like, "Oh, so you needed the procedure." And so that actually, in the case of limb lengthening, that's why I like the limb length discrepancy, because a limb length discrepancy has all these deleterious health consequences. And so if you say you had a limb length discrepancy, but that caused you to stand a little bit taller, when you explain it away as a medical necessity, the individual who's asking you about it is no longer judging you for getting it. And it's unfortunate. It's unfortunate that we live in a world where someone can't just get a cosmetic surgery and say, "Hey, I want to feel better about myself." Right. There's always an element of stigma tied to cosmetic surgery. It's really unfortunate. But, so long as society exists in that, paradigm, I think that just say, just any health condition would work. You can even say you had osteosarcoma, which is a tumor of the bone. You can say you had a rotational deformity. You could say you had, you could just say the word bone defect. For some people, that's enough. You're like, "Oh, you have to fix the bone defect." There's all these things that can really explain it away. And I don't think you should feel bad for lying, because if someone's going to judge you for spending your time, effort, and money on trying to feel better, then I think it's justifiable to lie in this case. And so, anyways, that's just something I want to add to Parth's question there.
That's phenomenal advice.
Yeah, that's true, because that's what I'm doing for my planning tibial lengthening surgery, because I do have a tibial rotation deformity, tibial torsion. So I tell them that, and for my right tibia, and then I tell them my left tibia has also a slight discrepancy, so that needs a little adjustment. So that's why I'm going to be out for a few months, and then when I get back, it just blends in pretty well.
It does. Yeah.
That's
fantastic advice by Optimus there. I mean, just use the medical terminology and use these medical excuses, and nobody will really ask you what the real true issue is. Really, really good advice there. And then did we get Leon? Yeah, no, we did. Okay, cool. So we got that question. All right, so we're moving right along here. Guys, I don't want to hold you up. Does anybody need to go? I'm probably going to cut it off in the next 15 minutes. I know I said that before, but I know there's a ton of chat questions here. Is everybody okay on time for 15 minutes?
I'm good.
I'm good for 15 hours, my man.
15. Yeah, Optimus players. I love it. All right, next question is from Katie. Yeah. She's saying, "We are taking our 17-year-old daughter who has hypochondroplasia to Dr. Paley for tibia and femur lengthening, a 4-month stay in Florida. How bad, on a scale of 1 to 10, is the pain right after surgery? Okay, so let's go ahead and get so we're assuming that they're going to hypochondroplasia. So that's a form of dwarfism. Optimus, I actually want to get your take on this because you had internal nails, and then Height Journey, you had internal nails as well for lengthening. So right after surgery, let's kind of just give Kate, I'm sorry, a little bit of what to expect.
HJ, you want to go? You want me to go first?
Okay, I can go. Okay, so you have a 17-year-old daughter. I think the pain will be very manageable. I don't think you really should worry about it because these limb lengthening clinics and hospitals, orthopedic hospitals, they have a lot of children. Like when I was there, there were a lot of orthopedic children having like bone deformities and bone, also some dwarfism, a few dwarfism patients, and so it's just like they have a lot of children. Don't worry about it. So they've done this for many years, many decades. It's not like anything more painful for children than adults.
Okay. All right. And Optimus?
Hey, Katsuyanis. So, yeah, I agree with HJ. I think that, these surgeons have years of experience in this. But I will say one thing that I think people often forget, that the surgical team is not just the surgeon. There's also an anesthesiologist. You have the OR staff. You have a lot of individuals that make up a team that are going to be responsible for your daughter in this case, for preoperatively, during this surgery, and then also postoperatively. One thing I will say, and then I wouldn't have known this had I not gotten my second surgery. It's the anesthesiologist's responsibility to have the pain medication order prepared and ready for the postoperative team in the computer. So for my second surgery, the anesthesiologist actually didn't have the hydromorphone or Dilaudid, that pain medication, ready for when I was waking up. And I was in about 20 or 30 minutes of just excruciating, unbearable pain. And it was bad because my mom and sister actually walked in, and they were freaking out because they were like, wait, what the heck? We thought he was just swapping a nail, and they saw me just like borderline crying. And then I found out from the PACU is the post anesthesia care unit, the PACU nurse who was responsible for giving the pain medication said that the order wasn't in the computer. And so I say this because, yes, these surgeons are great. Medicine is this like really advanced thing in the U.S. and in the West, but people forget there's humans running this kind of machine. And so what I would suggest to you is to have a conversation with the anesthesiologist and say, hey, can you make sure that the whatever postoperative pain management you give for the surgery is ready to go, and so there's no delay. And I think that's something that you bring up with your anesthesiologist in the pre-op, when your daughter is in the pre-op area. That way that she's not waking up in this excruciating pain, because it sounds like she's having she's going to have an osteotomy, and that can be very, very painful. Especially if they don't have the pain meds on board for post-op. So that's what I would say to ensure she has a comfortable experience.
Yeah. Another wonderful piece of advice from Dr. Optimus here. I mean, that is incredible, because I didn't even think about that the anesthesiologist has to have that stuff prepared. I just said, you guys better have it prepared because I don't want to be in pain. That sucks. You were in pain for like over 30 minutes. And we all know that 30 minutes is a long time when you're in pain. So,
oh yeah.
All right, let's see here. Moving right along. So Parth has another good question, I think. How are your femurs and tibias visually? Have they regained their original size, or do they still look atrophied? So I think he's talking about the bone remodeling. Have any of you guys gotten post-op x-rays? Leon, we haven't heard from you in a second. Have you gotten x-rays since you had your frame removal and everything?
Yes, but I didn't manage to ask them for a copy of my x-ray. But what they told me is that my bones are fully healed and they're just going through the remodeling phase. So yeah, how they looked at the surgery, say the screw, because I still got my screw and my internal nails still inside my femur bones.
Mm-hmm.
They said, yeah, everything looks fine. So yeah, for some reason they told me you don't really have to remove the screws in the internal nail. It's not really, but I'm still considering whether I want to remove it or not. So
Okay.
yeah,
Got it.
still.
So
But yeah,
everything is
my X-ray healing looks looks good.
looks good. Awesome. Nick, what about your X-rays? Have you gotten any kind of follow-up X-rays?
No, I haven't. It's been a while.
Okay.
Basically, I was just going to allot enough time to where, I know that consolidation is complete, and then I was going to get the nails removed, and then probably get an X-ray while I'm in Turkey, just because it's a lot cheaper.
Yeah, a lot cheaper than the US for sure.
Otherwise,
yeah, unless you can get insurance to cover it somehow, that'd be really cool. Just ask HJ how to do that. I'm just playing.
Yeah. When he says atrophy, he might have been. I think he meant maybe means the weight around body weight around your legs. Like, did you have skinny legs, and did you gain your weight back around your
maybe he does. Maybe he does mean muscular. I was thinking bones. Yeah, so maybe you're right. Maybe he's talking about muscle size. Then that's a great question. We'll follow up with that. But like, what about your X-rays recently, HJ? I know you went into Dr. A and you got some stuff done.
Yeah, if you look at my blog and my YouTube channel, yeah, they're doing very well. So like when I was lengthening, my legs were really skinny. My femurs around, and you can see the videos and pictures I have posted on my blog and YouTube channel. And because I was like around 150 pounds when I was normally before surgery, I was like 160 pounds. And then now I'm like 170 pounds. So I gained all my weight back as well. Not only did I gain all the consolidation, but I gained all the weight back.
Gotcha.
And then some because of the extra 2.75 inches in the femurs and the flesh in between.
Yeah. All right. I want to follow up with that with Optimus about, let's talk muscle or like mass of the legs, soft tissue, muscle. You said you gained a little bit of weight. What's the legs looking like now? I know they were, I forgot what you said they looked like before, but tell us how your legs
look. So I weighed 230-ish at the, I was like just a hair under 5'9", and I was 230. So I was big guy, and I always I've always had like thunder thighs. Like a lot of weight was in my legs. So for me, I experienced what I think is the only advantage of being overweight for the surgery, which is that when my femurs got lengthened, it actually like aesthetically looked better for me because they looked too sausagey, or I don't know what word I used before, but they were just like they didn't look very good. But now they're like, slightly longer and slightly more leaner looking. And because I already have a lot of tissue and muscle down there already, it just kind of looked normal. So I think, for bigger guys, like that's really the only advantage that being larger confers. Otherwise, I think that being lean is just way better for every dimension of the surgery, especially mobility and walking and all that stuff. And so, yeah.
Gotcha. That's awesome. And Leon, I know that we just saw it in your running video. Your legs look massive, man. They look muscular. You look like you're in shape. And I know you sent me another video. I'm going to post that on the channel later. Talk about your leg mass, your recovery.
So at first, like when I had the externals on my legs, lengthening, when I was going through the lengthening phase, my legs were so thin. Like, they say when you don't use your legs, you lose it. So I wasn't really using my legs on a daily basis. Like I was just lazy. I was more times just in my bed, just wasn't really getting up to walk. Because sometimes they say when you've got the externals, it's good to like walk up and down sometimes, just to exercise and circulate the blood in your legs. So to be honest, I was quite lazy during my lengthening phase with my physio, just because it was the pain. I felt like the pain really hit me hard. Yeah. It just made me just want to relax and just, I just didn't want me to get up. But my legs were very thin. So once they removed the frames, I just started slowly getting back to the gym. I was even doing a lot of swimming. I feel like swimming helped more like toning my legs.
Yeah. So,
yeah, but I really saw a lot of difference with my muscle with my legs. So that's what made me run, because my legs were weak and I couldn't even barely jog, so yeah.
That's awesome, man. Yeah, we saw it in the video, and I always say it says muscle moves the body, so it's like the more muscle you have, the faster you can
even when I started squatting,
yeah.
I used to squat with lightweight. Now I can squat up to over 160 kg.
What? Right now?
Yeah.
Are you kidding me?
Yeah, right now. Yeah, seriously.
What?
Seriously,
What are you
yeah.
doing, dude? That's crazy. That's like over 300 some pounds. Like I can't do the math. I suck at math, but that's crazy, man. Awesome. Your recovery went really well. You said, okay, it was a dark time for you, and then all of a sudden you're like the top of the game. Good job, man.
It just motivated me because I till this day I still think about the dark times that I went through, and it just makes me want to be more of a stronger person and just think, you know what, I just can't quit and just let this pain and struggle that I went through just defeat me like that. So yeah, it just made me be more of a like stronger person of, you know,
I love that. That is the cyborg mentality. That's what I'm talking about on here. Like after limb lengthening, it changed everything for me for my sport of bodybuilding, and it took me to the world championships twice, and it's going to take me there for the title win, of course. But yeah, I digress. That's awesome, man. Very good. I have another question in here for, I think it's Nick, and actually we're going to get Nick's take about his leg mass regain. And they're talking about nice jumps. Yeah. So, Nick, talk about, because they saw your recent video. Exactly. So leg mass, muscle, you've been hitting the gym. What is it like for you right now?
So when it comes to legs, I'm pretty conservative just because the nails, especially in my tibias, it does cause some pain, not a whole lot, but enough to like inhibit me, or enough to where it's a little uncomfortable. It doesn't really affect me with my femurs. It's mostly the lower legs. But as far as my mass, I wish I was wearing shorts. I could show you more easily. I have noticed a big difference. I can't really expose my upper leg just because, I don't know, it looks, I was just going to show you with the camera.
Yeah, that'd be great.
Yeah, I can't pull it up any more than that, but it looks pretty normal right now. And like my calves, I don't know how clearly that's coming through.
Tip it down a little bit more, Nick. I think the camera's, there you go. Okay, there you go. That looks normal.
So
yeah, that looks perfectly normal. Awesome. That's incredible. And I mean, like we said, Nick is like literally walking all day long, so he's probably getting muscle tone from that alone.
Yeah, I've noticed a big difference actually. So like this morning, my days kind of blend together because I work nights, but I was looking at my legs and like, oh yeah, there's a big difference as far as mass. You know, I've kind of recollected that mass difference from the atrophy. There's a lot of that.
I also think that there's some research, and Optimus, we need to do a research paper on this. I think that hyperplasia, fiber splitting, I think there's something to it about the eccentric loading of limb lengthening, because my left calf is far bigger than my right. Okay, and the judge is going to call me out on this. What's going on, man? What's your take on this, Optimus? I want to get your take about muscle growth after limb lengthening. Go.
Yeah, absolutely. No, this is pretty well studied. There's something called time under tension that's well published in the literature. There's multiple ways to grow muscle. You know, one of them is obviously concentric loading. There's also eccentric loading, but you know, tension is also a force that's forcing the muscle to add, basically make more of itself to bear that load. And so, yeah, I mean, I don't think anyone should be surprised that if, you know, a few months after consolidation or up to a year, that once they hit the gym again and start getting resistance exercise, or even when they start walking, you know, 10,000 plus steps a day, that they'll notice that their muscles are actually larger. And this is also more true if you take creatine monohydrate, not to get too much in supplementation, but creatine tends to draw water into muscle tissue. And so for those who have leaner legs and are wanting to get that like slightly more bulkier look, creatine is a good option for that. It has a bunch of other health benefits along with adding some muscle mass. But yeah, I mean, just because it's drawing water into muscle doesn't mean it's not real muscle. Aesthetically, it looks a lot better to have that.
Yeah, for sure, man. Yeah. I love that. I take creatine all the time for training and stuff like that. It's great. And yeah, man, I think that there is something to it. Like you said, tension loading. And I think there's not enough research on that for this, but we'll have to do a paper on that. Cool.
Yeah, right, a lot of the research about this is in like frogs, which is, you know, it's like, and these studies are often quoted as like, you know, the gold standard for why we know that, you know, tension causes what's called histiogenesis, which is just basically tissues making more cells. But yeah, I think that there's tons of, I mean, that's the really nice thing about cosmetic limb lengthening. It's really ripe for research, and there's a lot of really interesting questions you can ask.
100%. Yeah. Dr. Rosberg, Dr. Paley, they've all talked about that, the histogenesis of the soft tissue, and it's really interesting stuff. Okay, guys, so we're going to hop into two more topics, and then we're just going to kind of blast through we'll do one final through of the chat questions here because there's a ton of them, and today we don't have Randy of all days. There's like literally 480 different chat things here. But anyway, this one's about proportions. Okay, so Superman is asking, does torso to femur ratios matter, especially when sitting or walking? And does humerus to femur ratios matter when bending your knees or walking? So we're talking proportions here. Let's just go around the panel and get everybody's take on their current proportions after they've done their lengthening. So Leon, let's start with you.
With the proportion, I don't really see too much of a difference. Like I do, but especially when I sit down, I feel like my femurs do look much more longer. Like they look like, because when you lengthen your femur, you really see like the difference when you sit down. Because one time I was sitting down at a coach, and there was just everyone was sitting comfortably, and me, my femurs were proper like stuck with the other chairs. So I was thinking, yeah, if I didn't have had this surgery, then maybe this wouldn't happen. So yeah, so that's when I kind of knew that the proportions really changed for my legs.
Gotcha.
So
sitting on things like the coach bus or possibly airplane, I guess, public transportation, it can be a little bit difficult. HJ, what was your experience with the proportion change? Let's talk, size physically and aesthetically.
Yes. I have some videos on proportions. I do a lot of analysis. So the three basic proportions are not the humerus or to torso, but the three portions are arm span or wingspan to height, your legs to height, and your femur to tibias. The most important thing that really matters is your legs to your height, or leg to body ratio. The others are not really that important. It's been proven, unless they're way out of whack, way out of proportion. Nobody really cares, to be honest. I have above average length femurs after doing femur lengthening, but nobody. I've met zero people who ever say, "Hey, you have some really weird long looking femurs." I've never had anyone say that to me. I don't expect anyone ever will, to be honest.
That's awesome.
But the one thing you have to worry is about your leg to body ratio or your leg to height ratio. So if you just have longer legs are naturally good, but if it's like too excessively long, it's going to get really. That's when it starts to look really weird and unattractive. But it's okay to have above average leg length too. That's why models, they tend to have longer legs and they're considered more attractive. But that's all you really pretty much have to worry about.
True, the aesthetics of it. Nick, let's talk. Now, you did quadrilateral lengthening. You did both the tibias and the femurs, so that's probably the most ideal situation for aesthetically. But let's talk just physically, or let's go into both actually. Your proportions.
Okay, yeah. I know somebody was talking about the difference as far as femur and how that affects biomechanics. I've noticed the same thing, especially when you go from the standing to the sitting, or when you reverse that. There's definitely a big difference, just because it's the lever, and that scales linearly. So it is actually a pretty big difference. Okay. As far as aesthetically, I think my legs to torso ratio is about 1 standard deviation above mean, which I think is in the ballpark of the aesthetic ideal. I think that if it gets too big, then it becomes feminizing, and this is a dimorphic quality. Excuse me, I'm losing my voice. It's a dimorphic quality in that if you compare it to females, they don't really have that cap. They can have really, really huge legs to torso ratios, and it's just considered a feminine feature. It doesn't make them look strange, but with guys, it can look strange beyond a certain point. I think that's just my opinion. I know that it's a little subjective when you're talking about aesthetics. Somebody, I know in one of the questions, they were asking about walking. I don't think it really has any effect as far as walking. I think more so it's a cosmetic concern. But for me, legs to torso is about 1 standard deviation above mean. I could have lengthened more, but the caveat for me was aesthetic. I didn't want it to seem strange, and my arm span is about 6 foot. So there is a minor discrepancy now, but it's
don't know. Is the feed still going through?
Sorry about that. I think that it glitched for some reason. Are we good? Everybody good? Good.
Yeah,
I think
good here.
okay, cool. We got Optimus and Leon. Okay, cool. All right. Sorry about that, Nick. I'm sorry.
Oh, no worries. No worries. I'm sure the feed is still going through. But yeah, so I decided to stop at 4.5 inches, just for aesthetic reasons, because I figured, well, once I'm 6 foot, exceeding that can only make sense in my position. It is that's personal preference. So.
Yeah. That's awesome, man. Well, that's awesome because I actually said when I froze about your wingspan, I think that guys with bigger wingspans can get away with a little bit more than some other people. So that's cool. Very cool. Optimus, let's get your take on proportions.
Yeah, I agree with what both HJ and Nick said and Leon. I guess the only thing I'll add is that I think that whatever negative impact that, a proportional change is going to have is largely overshadowed by the fact that you're, much taller. So I think that, when it comes to like assessing this from a risk benefit perspective, I think that, the risk of a minor proportional deviance is really minor. And so I think, that is to say though that I think that there is such thing as too much. The leg to body ratio, I think for men, when it starts to look off, is somewhere around 0.53 or 0.54, I think. Which is, it would be hard to get to that without doing quadrilateral lengthening, and I think you have to do something like over 5 inches to do that. So I think for someone who is considering quadrilateral lengthening, I think there is a shift that happens at the 4 to 4.5 inch mark. Okay. 5 inches might be too much for some people, depending on how long their arm span is, and I guess how long their torso is to begin with. So there are things to consider, but they should not be deal breakers by any means.
I love that. See, he kind of said that the height increase can overshadow the proportions, deviation. And let's just, I'm not going to go.
There was one last thing about proportions. Like, if you're going to be disproportionate, it's better to like surgery will help. So it's better to have disproportionately longer legs and shorter legs. Or it's better to be disproportionately taller than shorter. So just remember that. So if you're going to be disproportionate, at least have longer legs or be taller than average. So that's
for sure. I think there's actually research on that. There's a research paper that I kind of quoted on that in one of my videos. That's really true. Okay, so let's just dive in on some scar. There people are asking about reducing scars after limb lengthening, and then we're just kind of sift through real quick. We'll do a rapid fire kind of question, and we'll do like a wrap up in the next 5 guys, this is going on forever. I'm sorry. Randy's usually keeping me in check here, but I don't have him today. So hero's journey. Look at that. They're following you. Hi, journey. Hero's journey. How can one reduce scars from limb lengthening surgery? Let's actually go to Leon and Nick, because you guys had the lengthening over nail method. So that's an external fixator with an internal nail. And then we'll go to our internal patients after that. So Leon, you first. What are your pin sites like?
They just look like keloid scars. Like they just look a bit. I would say you can like recognize that I've had some sort of surgery in my leg, especially the upper thighs.
Okay.
Because you see how the frames come from near the kneecap, the pins to your hip. So my physio told me that every other day put some cream and massage it for 10 minutes. So yeah, but my scars, they still do look noticeable. Like they haven't really, I wouldn't say it has faded away. It has faded away a bit, but they do really look noticeable. Maybe that's the point of when you get the lengthening over now, it does make it more of a scar in your legs.
Yeah, gotcha. Nick, you want to give your take on that?
Yeah. So kind of the same thing that he was saying, specifically with the upper leg. I know the scarring is much more pronounced. Even though I did lawn method on both, on the tibias, it's not too bad, honestly. It's again, I'll show you my leg, and it's not too bad. You see, I can't really see what you're seeing, so you'll have to guide me.
Yeah, I can
You
see
see
it.
like
Well.
insights, yeah,
Mhm.
but otherwise it's pretty minor. But you can see like this is from the femurs,
Mhm.
and then because you have more soft tissue at the proximal limb there is going to be some pitting with that.
Okay.
But like I don't really have any cosmetic concerns as far as that goes. At some point, I'm probably going to get like laser treatments. I think those are pretty effective. They like eliminate the scarring,
Yeah.
or at least reduce it by like 80%. It's pretty significant. I might be off on that, but I think it's about 80%. And then of course the method comes into play mostly when you're talking about the femur. Like precise is going to result, or Stryde, I guess, would result in minimal scarring. But the difference is much less when you're talking about the tibials.
No, that's for sure. Yeah, absolutely. And I also had an external fixator monolateral on my femur. And I remember it did leave, when I started to lift again and build muscle mass, there was protrusions or minor little minimal hernias where the pin sites were.
Oh, yeah. Because of the fascia, right?
The fascia. It went right through that vastus lateralis. So I know that Dr. Conway, she actually repaired it during my tibial lengthening. So if plastic surgeon, I know surgeons, they're really good. So if you go in for possible nail removal, they may be able to kind of sling a deal with you of, maybe getting that repaired well. Because all they have to really do is, close that up with some sort of, I don't know what they use nowadays, but mesh or something. Optimus might know. In fact, Optimus, let's talk scars, and then we'll go to HJ after that about, your femur. Now, you had the nail swap, which is interesting because did your scars stay in the same, or the incision sites stay in the same place, or did they move? Did Dr. D, what do you have to do?
Yeah, Dr. D was actually really brilliant with this. He actually used my scar from my IT band release as one of the incision sites for one of the distal screws, which was really worked out really well.
Right.
There are some little pin site scars because you had to insert an external fixator. And for me, he had to use what's called a dual frame, which is I had bigger legs, so there were like two incisions on my distal anterior thigh, right above the knee, but they're very small. They just look like scabs.
Okay.
And the same for proximally. So the external fixator didn't really do much. They're not going to be. They're the sort of scars that you can get from just like a fall or like from striking your skin on something. But then the other scar, unfortunately, they're proximally, because the trauma nail, they have to go in through a different incision. There are some proximal scars that were new, but I will say I'm sort of lucky in that I grow a decent amount of hair on my legs, and so I shaved just to help out the OR staff, so they didn't have to shave me during the surgery. But as soon as my hair grows back, I don't think any of my scars are going to be very visible. So if I was like being intimate with a significant other or something, like I don't know if it's even going to be a thing. And I think for people who are worried about like the proximal scars, if you think about it, the only people that'll ever see your like your underwear line or your proximal thigh are those who they essentially have to see you naked, and so that's a very small group of people, I think, in today's world. So I think like scars are. So anyway, that's all to say. Scars are a minor issue if you grow hair. If you don't grow hair and you're worried about the cosmetic aspect, just like Nick said, there are procedures, plastic surgery mostly, procedures, and dermatology can do this too. So just go to whoever gives you the better price. They can reduce scars from 65 to 90% or so. It's a wide range because of the method being used and also the experience of the practitioner. But there are cases where, like, if a running a subcuticular suture was done well during the surgery, and the skin incision was tight and kind of very clean from the initial surgery, from the initial puncture, that the laser removal can actually reduce it to almost 100%, like where it's not even visible. So you can look up before afters of this on Google. There's quite a few. So yeah, if someone is very cosmetically concerned, or I would. Don't worry about it, because there are options down the line that are not very expensive to get those scars removed.
That's incredible. Wow, man, that's intense. I didn't know that. All those different techniques and methods that you had there. And then and I actually know that. No, I'm not going to go on to a tangent. HJ, your take on scars?
Yes. Like Some people suggest using skin creams. To be honest, I never really use a skin cream. I think the best way to do it is just let their body heal by taking the proper nutrients. Because, first of all, like take that you would normally take while you're like lengthening, like number one, protein. That's the building block of cell repairs, including skin cell repairs. So take a lot of protein. That helped a lot. Number two, multivitamins, like a lot of B vitamins and biotin. Just take a multivitamins. There's so many vitamins that can help out your skin, and including skin repair and skin healing, and also keeping good skin. And number three is omega-3, like fish oil caplets or tablets, because not only does omega-3 help you with bone formation and bone healing, it also is good for skin healing as well.
Yep, that's right. And vitamin E. Yeah, and I think also one thing that, because I know that keeping it out, prevention for your scars. So in the first year, I think I'm echoing somewhere, but anyway, keep your scars out of the sunlight. I know my surgeon for my pec tendon repair, and Dr. Conway said the same thing, is keep them out of the sunlight because it can darken the scars, especially if you're fair skin, for the first year until your skin gets that normal color back, and it lightens up a lot. So, because that's if you're not planning to get it repaired surgically or by lasers. So very cool. And then I think we already talked to Leon about his scars, didn't we, Leon?
Yes, we did.
We did. Okay, cool. All right, guys. So, oh my gosh, we're almost on 2 hours here. When do you guys want to end? Let's see. Let's just skip these questions here. I think, okay, last real question, and then we're doing our rapid fire. Removal. Optimus, this is you, because I think he's talking about removal of the nails of the femurs. He wants to know how painful it was. I know you said it earlier, but on a scale of 1 to 10 versus the first surgery, what would you say?
So I can only speak to nail removal in the context of reinserting a trauma nail. So from that perspective, I think it's probably like, I don't know. I have big thighs, so I get a lot of swelling, which is a disadvantage. For me, it was like a 7 out of 10 pain, where maybe the first surgery was like 8 to 10 out of 10. But yeah, so I can't speak to removal. So I think Nick or maybe Leon, I don't know which of you had just the removal with no reinsertion of a nail. So I think that's what maybe my YouTube is asking. But for me, I know that the reinserting another nail was painful because they have to re-ream the canal and also add more screws. So from that perspective, it's more painful than you expect it to be. So I'll just say that.
Gotcha. Okay. All right. So then we're going to do some rapid fire questions. I'm just going to try to get through the list real quick, and then we'll do kind of an outro in a sec. So Jay News asking, this is kind of like, we'll just go around the panel. Is it better to lengthen just the femurs only, or best to include the tibias at some point? HJ.
That's I think you have to be a little more specific. Like,
yeah, I guess
maybe if you're thinking like, is it better to lengthen the full 8 centimeters on the femurs, or better to lengthen like maybe 7 centimeters on the femurs and like 4 centimeters on the tibias?
Let's put it like this: if you had the option, the resources, the time, and the work ethic, and ready to take on the world of pain to do both, would you just say, hey, look, do the femurs, you'll be okay with 3 inches at 8 centimeters, or would would getting the tibias done as well be something?
Yeah, it'd be nice to do the tibias if you can afford it, but most people really can't afford it. That's the main issue why people don't do both segments, because it's hard.
Okay, I'm gonna get
one surgery is kind of difficult to afford, so
right.
Trying to do 2. I know a lot of patients who did either just the femurs or tibias. They didn't plan to do the other segments, but they were so impressed about it with the results that they eventually decided to lengthen the other segment as well.
Yeah, that's for sure. Now I want to get Optimus and Leon, and then I want to talk to Nick, who actually did both. So, Optimus, are you considering tibia lengthening?
Yeah, so I initially wrote off tibia lengthening when I was kind of in the midst of distraction. Actually, when I hit like 6 centimeters, I'm like, oh my God, this is the worst thing ever. 6 to 8 was really rough. And so that was when I was like, oh, I'll never do tibias. But now I'll probably come back for tibias like years down the line. It won't be anytime soon. It'll probably be like 4 or 5 years later. Okay. and the reason for that isn't really for the proportions or anything. It just because like, yeah, there's a point when you become so impressed with how much the pain goes down, how much your mobility goes up. Like recovery really starts to go up exponentially, especially when you're like well out of distraction. That like you're like, oh wow, like once you get through the bad part, it's not so bad. So to answer New's question, in a perfect world, it's better to do both. I think Dr. Sung Hoon Lee said this too. He said, proportionally speaking, and also from a functional perspective, it's better to do both. But we don't live in a perfect world where people can, give up like 6+ months of sabbatical or whatever. So, doing the femurs is better than doing just the tibias. But I would say in order of ideal, it would be doing both is number one. Number two is doing just femurs. Number three would be obviously doing just tibias. So that's kind of what I would say about that.
I agree with that. That's a good answer there. And then I think we touched to Leon Leon, let's get your take on this. Are you considering doing the tibias as well? You're well over 6 foot now. You're what, 6'2"?
No, 6'3".
6'3". Oh my God. He's good, right? You're good.
Yeah, I think I'm satisfied for my height, to be honest. Yeah, I wouldn't really want to go for another surgery, tibia lengthening.
Yeah. I think that what Optimus said does have some serious merit to it. Is like if you go through it once and let's say you didn't hit the height threshold that you wanted, it makes it a little bit easier, even though the pain is going to be there and stuff like that. That's why I wasn't really fearing it. I've been through the hospital was my second home. I've been through multiple surgeries before limb lengthening. It sucked, don't get me wrong, but it was a lot easier. Now, Nick, I want to get your take on this. You did do both.
Yes.
But let's get your take on what Janu's asking here. Is it better to just do the femurs, or are you happy with your decision to do both?
I'm happy with my decision to do both. I think I was a good candidate for it for a few reasons. I couldn't come up with a generic answer that fits everybody. So there can even be a lot of variance as far as femur to tibia ratio. So if you have somebody with a proportionately long femur compared to for somebody else, it might be ideal to do just the femurs, and that particular person, they should probably do the tibias. Otherwise, if you elongate it further, it's going to look even stranger at that point. So it's kind of hard to get a one size fits all kind of answer there. But I really agree with what everybody else said. And just again, for me, I'm happy doing both because my femur to tibia ratio was normal before, and now it's still normal.
That's awesome.
And the cumulative height gain is also pretty big. I wouldn't be able to do that, at least not safely, just doing the femurs. So
that's another thing. It's like going for that height goal. Like if it's 6 foot and you're, let's say 5'8" or something like that, you're going to have to do both anyway. So that's very cool. That's very true. All right, guys, we'll just go for 10 more minutes. That'll be the 2-hour mark. Let's just do that anyway. So, we already pretty much are there. So, all right, everybody good with that? We'll go 10 more minutes and then I'll do the wrap up. So, going down the list here, Parth is a question. Vic, finally a question for me. I feel so wanted. When are we going to see your new documentary with Rich? Oh, man. I actually don't know. So Rich is actually currently lengthening still, and he's still recording down there. So I'm following up with him regularly. I think he texted me today or yesterday. But our goal is to actually hopefully have it out in the next, year, probably 8 months to a year. It really depends because we want to kind of make it fine-tune, edit it, and everything like that. But it is literally following him through his stature lengthening journey, why he wanted to get it done. He's getting it done at the Paley Institute, so we're literally getting the takes of both Dr. Paley, Dr. Robbins, their physical therapy, just the whole experience of stature lengthening, so everybody can see. And Channel 12 News, CBS down there is documenting as well, so it's pretty intense stuff. So we're hoping. The reason why I was a part of this documentary was really to kind of help direct the narrative in a positive manner. Versus just let it be out in the wild like some, other articles and whatnot, which can get, a negative connotation. So we're hoping in the next year, but I'll follow up with Rich and we're still working on that project. So it's still in the works, Parth. Okay, let's see. We're just going to go through these questions. This one's for Optimus. He's saying, I hear you, Optimus, but if people judge, just let them out of just get them out of your circle. He's talking about what you were saying. All right, let's see here. All right. I don't even know if anybody had questions. They were just chatting. Everybody had a good time here. I mean, and by the way, I want to thank the audience. I mean, we've been well over 30 viewers and steady for the entire time. I really appreciate you all showing up for this roundtable. I know you guys love these, and we're going to have more of them. All right, here we go. Leon, let's actually take this to you guys. This is about walking normally, okay? I think this is really important. So I think we all need to go around the roundtable here and talk about this. So, Leon, when were you able to walk normally after your surgery?
After my surgery, I'll probably say. So after my surgery, I'll probably say by November. So I got my frames removed in July.
Mm-hmm.
So it took me around like November to start. Obviously, there was a bit of a note, like I was limping a bit, but I would say from November, that's when I could gradually start to walk back to normal.
Okay.
But I would say January, I started walking swiftly and just calm and just, yeah. So
Okay.
I'll probably say November. It took me, after the removal, that's been the frame removal, it probably took me around 3 to 4 months to walk back to normal.
Okay. Yeah, that seems about like on point with a lot of other LON femur patients that I've spoken to. Okay, going around the table here. Nick, how long did it take you to get your normal walk back?
So that didn't happen until after removal of the devices, and it was about 1 to 2 months after removal for me.
Nice, to get a normal walk back.
To get a normal walk, yeah.
That's impressive, man. That's fast. That's awesome. I guess he was really busting tail at the physio. Height journey, normal walk, not just like, walking gait, but like actual walking normally.
Okay, there's a formula out there for the precise nails about when you can start walking normally. For femurs, it's about, for every day of your lengthening, it's about 1 day into the consolidation. After 1 day, each day of consolidation, you'll start walking independently. You'll be starting off walking very slowly and awkwardly like a penguin.
Mm-hmm.
But after like about 2 months of physical therapy, you'll start walking normally. So for example, if you're lengthening the femurs for 3 months, and then 3 months into consolidation after that, which is 6 months after surgery, then you'll start walking independently, but awkwardly and slowly. And then another about 2 more months, and then you can start walking normally, which was pretty much my case as well. And they see for the tibias is about, for every day of lengthening, is about 1.5 days to 2 days of consolidation for the same stage as the femurs. And then plus another about 2 more months. That's when you can start walking independently. Then 2 more months, and then you start walking normally. That's what they say about tibias.
That's interesting. Wow, I didn't know there was
some tibia diaries. I think that seems to be accurate.
Okay. Well, I think that, and I think it does vary for each patient, but that's good that you give like those average time frames so everybody knows that it's walking and then it's walking normally after. So, and then Optimus, now you just have the trauma, you just recently had your trauma nail placed in so you can actually weight bear. What's your walking like right now? Is it kind of very stiff and kind of cautious, or what's your walking gait like?
Yeah, first thing I want to say about this is there's a really good video about when you can return to a normal gait on this YouTube channel called Cyborg for Life. You should all check it out. The video is literally called, like, when can I expect to have a normal gait? Anyway, there's a joke there. But yeah, the really great video. Vic has a very good video about this where he covers, like, all the different devices and approximately how long it takes to get a normal gait. That said, I'm in a bit of a unique and sort of outlier position here because I'm a above average weight patient who had the trauma nails placed 10 days after distraction, and so for me, I don't have a normal gait yet by any means, but I can say that 2 weeks after the nail swap, where I'm at right now is that I am still using a walker and a wheelchair. I actually have an electric wheelchair. That's helped me. I invested in it because I was independent a lot of the time during distraction. It helped me get around the apartment and stuff. But so I go back and forth between my wheelchair and my walker. But my walk is, when I'm on my walker, I can fully weight bear, but it's not a normal gait pattern quite yet. But every day I feel like it's improving a little bit. Right now I feel like my legs are just like a bit stiff. The muscles are still weak, so they're still waking up. If I was to predict when I'll lose the walker, I think I'll lose the walker in about 2 weeks, which is about a month after the swap.
Okay.
And then I'll probably get a normal gait pattern, like, I don't know, maybe another month after that. I'm not sure. It's really hard to say, but yeah, it's a tough thing to say. I'll report back to you, Vic, about this, because I think other patients who are interested in this sort of like option to go to convert to full weight bearing will probably want to know how that affects the timeline.
Yeah, we're definitely gonna have Optimus back on. We're gonna be doing these check-ins with these guys more regularly. I just saw a really good question, but it was jumping on me, and it was asking about. Let's see here. Besides, oh yeah, here it is for Nick and Leon. This is good for people who are considering the LON method. The removal of the internal nail in the femurs. Now, obviously, and this goes for you as well, Optimus, because it's a trauma nail, so you technically don't have to get it removed because it's not magnetic. But are you guys going to consider getting it removed? Let's go with Leon.
It's been a decision where I haven't really choose what to do yet, because it's just the fact that, do I really want to go through another little setback of getting it removed and going through that phase of, because I heard that once they remove the nail, your bones will be weaker. There might be a risk of fracture because there will be a hole in your femur bones. So, but it's weird because sometimes when I do certain activities, I sometimes feel the nails in my leg. It's just weird. So it does give me a feeling whether if I do want to remove it, but I'm still like in the middle, still like not sure whether I want to remove it or not. But time will tell. Maybe I will remove it, or maybe not. So yeah.
That's a good one. And then, and I think that I'll just hop in there. I think if it doesn't give you big problems and everything feels normal and you're happy and you're content, and then why? You don't have to. There's no urgency for you. However, like some surgeons say, is that over a certain amount of time, the ossification of the bone can cause it to be a little bit harder to remove. So within, I think, a 2-year time frame after that nail was inserted, might be a time to kind of make that decision. So again, it depends though. But Nick, are you going to get your nails removed at some point?
Oh yeah, absolutely. Probably within a few months.
Okay. Oh, in a few months. Wow. Okay. Awesome, man. Very cool.
I don't have any definite time, in place right now, but I'm thinking in a few months.
Few months. Okay. Well, the good thing is that it doesn't set you back too long in terms of like recovery. Usually you're back on your feet 2 days, 3 days later. HJ, what about you? You're going to get your device removed? Well, you have to, right?
Yes. I was planning to get it maybe in a few months, but with the tibial lengthening, I'll just do it with the tibias. But I did talk with patients who had their precise Stryde and also LON patients who had their nails removed. They very highly recommended you get it removed because it feels much better, and it's like it doesn't weigh you down as much. And like when you're like sleeping under certain positions or laying down, you won't feel it anymore. It's just a lot more comfortable, and it just feels a lot better. So they all unanimously recommend you eventually remove the internal nails when it's ready.
Gotcha. And then Optimus, let's get this last one with you. I know you have that trauma nail in there. Are you going to get it removed? But you have a busy schedule coming up. 4th-year medical student residency coming up, everything like that. What's your plan?
Yeah, I wouldn't be a cyborg for life if I got the nails removed. So I plan on keeping these for life, baby. Let's go. On a serious note, if I do get them removed, it won't be for another 4 or 5 years. So, I'm just gonna have to. I imagine that trauma nail people have trauma nails in for life, and it's not an issue. So I'll just see if it's something that bothers me in a year or two, then I'll find a way to take a 2 week or 3 to do the removal during like a vacation or something. But otherwise, I plan on keeping them in.
Okay, very cool, awesome, guys. All right, well, I think that's it. Really, we're just gonna go around the round table. You guys are gonna just give shout outs, final words of advice to future prospective patients, your fans. You all are like people love you out there. So let's do that, and then we'll do the wrap up. So HJ, go ahead and talk to your people.
Okay. Yeah, I can't explain everything in just a few minutes. We've already been here like 2 hours now. So if you want to see my blog or YouTube channel, You just have to either the YouTube search or the Google. Just look for the word height journey, and you'll find it. You'll find it's going to be the first entry. You won't miss it. And I mean, I can't explain everything in just a few minutes because I keep saying, like limb lengthening surgery is a very large and complex topic field, and it's always also changing constantly. So I'm just there's just so much information out there. So just look for that. You can search for it, or I think Victor said you were going to put the links also in the description of this video as well.
Yep,
and that's the best way I can just explain everything.
Okay, yeah, definitely check out HJ's channel. I'll be putting it below this video after we get off stream. It's Height Journey on YouTube. Nick, give a shout out to your lovely fans out there.
All right. One thing, just want to say thank you for the support. I've had a lot of people, just the reception is much more positive than I thought it would be. So not that I thought that people would be overly critical or anything like that, but it's really cool to see. So I'm very happy about that and very appreciative too. So and there are a lot of people who have voiced to me that they're going to get it done sometime in the future. So I wish all those people very good luck, and please keep me posted.
Absolutely, man. Yeah, and you can check out Nick's amazing YouTube channel as well. I'll be posting his link below as well. It's Nicholas's leg lengthening journey. So check for that after the stream goes off air. All right, Leon, man, you have a big fan base as well, man. A lot of people have been begging for you to come back on and give your update, so they're happy to see that you're recovering well. Go ahead and give them a shout out.
Yeah, definitely. I feel like I've done it for the fans, Definitely it was great coming back on and just updating them of my recovery. But much thanks to you, Victor, as well, because I felt like you've played a part with my surgery, because before I even got the surgery done, I was quite skeptical going through the internet of limb lengthening, and obviously when I came across your YouTube channel, it just gave me that reassurance of, getting it done. And yeah, so much thanks to you as well, Victor.
Appreciate that. Awesome. And then we're going to finish it off with Dr. Optimus. I'm just going to start calling that. You got to use that in your name next time, Dr. Optimus.
I'm gonna have to change it to that, actually. Yeah,
you do. You have to.
Yeah, I just want to say thanks to everyone on the panel. Everyone on this roundtable has been valuable. I watched a lot of you guys' stuff before I got my surgery, so it was really helpful. And obviously, Vic, Cyborg. None of us would probably be here if it wasn't for Cyborg for Life. So thanks to you. I guess to keep it short but sweet, if you do decide to go through this surgery, I'm quoting several surgeons here, but just remember a few things. One, that it's a life-changing procedure. You can't have a life-changing procedure without a very difficult course. And so just remember that, it's difficult for a reason. It's expensive for a reason, because if you make it through the other side, and it's just absolutely life-changing. That's totally true. The other thing is, maintaining patience. If you have to get slowed down, or if you are in pain, just remember most things in this surgery are temporary, and it gets better in time. There's that song from, I forget which band, but this too shall pass. That's a very important perspective to keep when you're going through this, because if you are in pain, or you're stiff, or it's hard to walk, all these things, if you believe that those things will last forever, you'll have a tough time making it through. But just remember that it's all temporary, and the human body is this amazing machine that tends to heal itself in a lot of ways. So yeah, just be patient with the process. Make sure you have connections to, or maintain a support network, whether that's through Vic if you don't have any family members, or through other limb lengthening YouTubers and such. I'm sure they're more than happy to help. So that's all I'll say about that.
Amazing words of advice. Well, and I will give the final thanks to all of you amazing YouTubers and patients here on the roundtable. It's been incredible for you guys to come out and share your updates with everybody. I mean, that's one of the biggest things. People are like, how are they doing now? Are they running? Are they jumping? What are they doing? And I'm glad you guys were able to come back on in this fashion to do that. And I want to thank everybody in the audience as well, you viewers. If it wasn't for you, we wouldn't be here. Okay, so I want to thank you guys for coming out and staying here for over 2 hours with us all. And we're going to be doing more of these. Okay, so really appreciate that. And yeah, that's all I have to say. So That is it for episode 35 of Lengthening Live. And until next time, this is Victor from Cyborg for Life and these amazing lengthening patients. See you guys next time. Peace out.